Thank you for the introduction. I'm Jujihan, CEO of Ipsel. We focus on recovery, regenerative, and rejuvenate model. So I'll elaborate about the background and the status. I just rushed from another exhibition room to here, I feel a bit confused. Sorry for the mess. Well, when here, there's a blastocyst period where the egg cell has the stem cell, the embryonic cell, and the stem cells used in the stem cell are mostly adult cells, and from ordinary like human bodies, if you put this factor, then there will be cell reprogramming, and it differentiates in a stem cell, which is called the differentiation cell, which won the Nobel Prize. And based on this induced pluripotent stem cell, we work on research. I myself is a internal medicine doctor at Catholic University of Medicine, and I founded this bioventure company and induced stem cell. And all the platforms and stem cells are being done in my company. Through over a decade of research, we completed a Series A, and we won about 15 billion investment, and we are looking forward to moving on to Series B investment. So compared to the first generation stem cell companies, the ingredient changed from MSC to iPSC. So now there are 3D based forms, and there is advanced convergence technology. So in the past, those biopharmaceuticals ones were considered good ones, but recently CAR T, among other third generation biopharmaceuticals ones, were developed, and we want to take another step from that, which can recognize other human bodies, and it can come up with QC or other approaches. So we're developing in that sense. So when the human body ages, you can your spirit or your physical body would degenerate. However, based on our technology, we can regenerate cells or cover cartilage degeneration. So thanks to this recovery and regeneration, you can the elderly can enjoy some the younger body compared to the past. So we have research team and research support team, and we just recently entered the licensing step. So we're staffing more members. So there is more demand in clinical trials. So we're strengthening that department. So these are the staff members. We have one or two member each month, so it's difficult to say the entire number of staff members, but I would say approximately 25 researchers are working for us. And I myself is the CEO of this company, as I said, and at the Catholic University, I work as head of Induced Pluripotent Stem Cell Research Institute. So I am fully aware of the characteristics of this technology, so that I am making use of this platform so that it can benefit us. And in the early stage, we got support from the Ministry of Health and Welfare, and we founded our headquarters, and we built another building in Seoul building back in 2020, and we will keep working on expanding our market. And next month, we will move our headquarters to the Omniverse Park in Seoul, Sangmo Hospital, which is our grand plan. So currently, we're focusing on this. So I myself is a specialist in osteoarthritis. So this is our goal to work on this. And since you can see that this cartilage, if it is degenerated, then in the conventional medicine, they used painkillers, or and then you needed artificial um, junctions, then it takes about 20 years. But we can't wait for this. So we wanted to create junctions or cartilage based on our stem cell technology. So we're working on developing them. Of course, there were some similar efforts in the past. Like if it suddenly happens in patients, in the past, autoplant technology was used, or graft technology was used, and cartilage or Chronaxron, among other medicines, were used. However, nowadays they're recognized as a failure because they showed low efficacy, and scientifically, were they proven to have efficacy? Well, it's not clear to say yes. So the research based treatment in the past, indirectly inducing it to regenerate, was the conventional medicine, but we actually want to directly reproduce cartilage in the human junction. So, in order to do so, we wanted to change the material, and let's come up with a new system and new form. That is our key strategy. And in the past, most of the treatment was surgery-based one, but recently, the field is focusing on multiple compound treatment, so that lasts longer than simple surgery. So, not only Korea, but the global market is developing and conducting research, and we want to make another step. And I myself, as an internal medicine, not operator, so I wanted to develop a injection form. So we're working on developing that medicine. So this is how it goes. So you activate this biological reaction where you can attract various cells. So it's a very active form. So over the past 6 years, we have conducted various bodies of research to see a reaction and efficacy. And for example, here we created a junctionless animals, and then we injected medicine. When we injected placebo, it didn't show any difference. However, if we actually did inject our medicine, then you were able to see the arthritis induction. And but it was animal test, so and needed to move on to human bodies. So you can compare the results here. So we are working on seeing the efficacy of human protein regeneration, and we're able to see the humans cartilage regeneration effect. And this is the recent data found from 2 months ago. And here we injected this cartilage regeneration inducer in the pig's body, and about 30% efficacy was found scientifically.
So at the end of the day, the impact and effect we can benefit from is that a cell is going to be activated near the cartilage, and as a result, a different data is being built as well. And as we are working on these matters, we call our product Mucon. This is minimal injectable control space, and I worked very hard, and because our employees and workers have suggested ideas, and we got approval from the FDA as well. There's one data that we are waiting because it takes about 1 year to get the approval. But I believe the biggest fruit we think is that the FDA is now recognizing the perspective of new domain um, approach. The banking system, QC, and CMC, we learned a lot about the internal process, and based on these findings, we are able to go on and build on to different pipelines. You can see that MCB, WCB, QC is going to be established, QC, CMC are going to be made as well. And iPSC can divert into all kinds of cells. You can create MSC, you can also make INK, And from all the cells from these cells, like secretinome or exosome, we can apply and utilize these further to other businesses and commerces. And I believe this will serve as a great foundation and infrastructure. So, cell ingredient platform business is something that we recognized by working with other companies and leaders, and we're realizing that as well. And this is one model where other partners are working on anti-cancer drugs, and they would like to use our Mucon iPSC based NK cell therapy, because we already proved the generation impact. And if you can just take this simply from us, from the latter part of the process, they can use their own structure and technology. And for secretinum or exosome, the cell culture companies are working with us as well, because the material has completeness. If you look at our product, so it's very important and easy for them to get the approval from the FDA side as well. So today, for internal usage, there's cell um, Alzheimer disease impact and efficacy is being monitored. And currently, because we are focusing on the completeness of the ingredient itself, if you look at the profit model, I think it'll take about 3 to 5 years until we get the benefit. And what we can generate when it comes to margin in between these are these profitable models with other collaboration. We can create IPSC package itself to co-work with other companies so we can sell this item independently. In the past, we focused on autologous, and I feel like now we are working on allo more. And what we actually want to see is that many different patients' auto IPS banking could be done, targeting all citizens in Korea. That's our final target. And because we're tight in time, let me move on. So currently we're making version 1.0, 2.0, and 3.0 for IPSC. It may seem like it's very complicated, but these are all clinical grade GMP, grade FDA responsible cell strains, depending on how much intervention you're using or how much rejection you're receiving. Different cells are going to be controlled and managed. And these are basic cell lines. And there's also a premium cell line as well. If HLE representation is going to be adjusted so that we can make a premium cell line and launch this next year. And in addition, with IPS, as we are making cartilage cells, we have to go through the MSC stage. Currently, we took MSC from patient and then we put it back on the patient. So it's really hard to commercialize it because we have to make sure that invasive taking had to happen, and the amount of the cell MCS was itself very limited. But now we are working on um, duplicating MSC unlimitedly, so there is low cost and high efficacy, and we should be able to provide this off the shelf by uniforming the quality of the cell. And this is the last part of my presentation. As I shared earlier, we are working on arthritis, and I think the market size is about 4 trillion won. And I believe that cartilage regeneration, alternative medicine market will be around 1 trillion. And I believe that injectable cell therapy is going to be around 64 billion won. So I think we are going to target 33% and then eventually to 1 trillion won. And because so many people are interested in degenerative arthritis, I believe that we should be able to achieve our target quite easily and smoothly. So let me summarize my presentation. These are what we have. These are platform technologies. We create cell culture, cell strain. We adjust gene strains, and we can make universal cell lines. We can facilitate this process by adopting automation. We can utilize AutoCell and Cell Drive Basics with other companies. There is anti-cancer drug cell creation working with other companies as well. So let me move on. So these are our employees. There are about 25 people working with us. Thank you very much.